Welcome to the CARE Challenges and Solutions for a Sustainable Future International Conference. Thank you for joining us for the third session of the theme, Technology and Care, Opportunities and Obstacles in Place-Based Care Context. My name is Matthew Lariviere. I'm a lecturer in social policy at the University of Bristol, and with Andreas Hoff, one of the co-conveners for this theme. I will be chairing the session on the topic of digitizing social policy and its implications today. This session focuses on understanding this policy context, digital transformation in adult social care, and its potential consequences for the care systems, care recipients, and carers. This session consists of 3 papers from scholars in the UK and Sweden, followed by a discussion of key areas of convergence and divergence across these 3 papers. I'd like to introduce the first speaker of the day, who's Dr. Kate Hamblin. Kate is a senior research fellow at the University of Sheffield. Today she'll be talking about her paper on challenges to care system sustainability and the role of technology, the English policy landscape. Over to you, Kate. Thank you for joining us.
Thank you, Matthew. So the work I'm going to talk about today is part of the ESRC funded Sustainable Care Connecting Peoples and Systems programme. And the focus is around a project we've been doing looking at the potential of technologies in sustainable care systems. Next slide, please. And in this presentation, I'm going to talk through some of the challenges that adult social care is facing in the UK 4 nations, examine the role of technology within adult social care policy and practice, and explore some of the potential that technology offers to develop sustainable care systems and deliver wellbeing outcomes. Next slide, please. I'm not going to go into too much detail here because I'm mindful of the time, and there has been a lot of discussion about the challenges adult social care is facing in the UK, but these relate to population ageing, but also that disability-free and healthy life expectancy haven't kept pace with extended life expectancy, leading to an extended period of poor health for many in later life. The changes to family and household structures, such as solo living in later life, increasing childlessness, increasing distances within care networks, all creating a demand for care while supply is changing or reducing. And at the same time, publicly funded adult social care is under pressure due to the effects of austerity. But in our review of these challenges, we noted that they're not evenly distributed among the population, but also among different local authorities. So there are parts of the UK where some of these challenges are more pronounced. So we see more ageing populations and solo living in later life in rural and coastal areas. We see more issues around healthy life expectancy and disability-free life expectancy being on the lower end in metropolitan areas, such as Nottingham and Slough and Wolverhampton. And we've also seen uneven reductions in adult social care spending. So the more deprived areas of the UK have made the greatest cuts to adult social care in comparison to the least deprived. Next slide, please. And as a result of some of these challenges and perhaps reflecting them, technology has consistently been presented as a solution to the crisis of adult social care throughout policy discourse in recent years. And technology has been part of adult social care services since around the 1960s, with the creation of social alarm systems within sheltered housing schemes. And these evolved over the time to be in all housing stock and people's private homes as part of telecare systems operating via telephone lines and facilitating the whole ageing in place agenda. But in the UK, we really saw a widespread investment in telecare from around the mid-2000s, with a series of national grant programmes for local authorities to invest in telecare, and they're detailed here. And there's also, this agenda went hand in hand with investment in research to create an evidence base for technology and its use in adult social care, including the largest randomised controlled trial conducted to date. Next slide, please. But this approach has received some criticism. Recently, there was a paper published in Ageing and Society, which talks about it and questions whether technology in adult social care is a suitable fix, a panacea, or, to quote Poles and Williams, a hazardous investment. And the idea that the author Andrew Eccles discussed was yes, there are undoubtedly some benefits for older people of using technology in adult social care, but often evidence and investment, the evidence wasn't necessarily there for the national level investment that occurred. And he cites the example of the whole system demonstrator study, which didn't demonstrate the cost savings for telecare, and yet the policy discourse that followed that very much still cited cost savings. And there were questions at the time around how the results were being reported in terms of cherry picking. And Eccles also highlights that, when they didn't get the answer they wanted from the whole system demonstrator, they invested in more research, but this didn't necessarily precede investment they were making in local authority provision. And he describes it as policymakers were on the same trajectory of ignoring the inconvenience of evidence. But the funding rounds that happened in the mid to late 2000s also have been critiqued for amplifying differences between local authorities. So the more developed local authorities with more, in terms of their technology offer, bid for more money and were able to take their services further, leaving greater gaps in provision around the countries, the four nations, and also differences in charging policies that between local authorities having implications for social justice and fairness. And perhaps a bigger critique is around whether a top-down approach works in this context, because technology use in adult social care is a complex intervention and it requires an understanding of the local context, and so a very top-down approach isn't necessarily appropriate, is one commentator's perspective. Next slide, please. But nonetheless, in spite of these issues, the appetite from policymakers nationally and locally for technology seems largely unaffected by the evidence issues. So the recent Utopia study at King's College London found actually very little impact of the whole system demonstrator findings on local authority commissioning decisions. And the appetite is also shifted with the move to digital. There's been an emphasis on the potential of digital technologies and mainstream technologies within adult social care. And the current Secretary of State for Health and Social Care, Matt Hancock, is very much a technology enthusiast, saying, let this be clear, tech transformation is coming. Digital technology is not only a question of opportunity in adult social care, it's also a necessity. A lot of the existing telecare provision or technology-enabled care services provision, as now it is known, operates on analogue systems, which will be turned off by 2025. Some areas have already undergone this switchover. So these systems will not function reliably and will need to be decommissioned. So perhaps as a reflection of this or linked to this, we've seen recent investment in funding for pilots and research projects for local authorities and also care providers, exploring the potential of digital technologies, including mainstream devices, AI, data analytics and prevention, and robotics. And there's some examples there of the various programs that have been available in the past few years or are still available. And there's also been the creation of bodies such as NHS Digital and NHSX and the project Digital Social Care to try and take the agenda of technology within care further. Next slide, please. However, with these digital technologies do come some challenges around the digital divide, which refers to access to devices, but also in the skills and confidence to use devices. And we know that older people are the greatest proportion of internet non-users, and we know that there are skills differences geographically in the UK around digital, with areas of the northeast where people have the lowest level of digital, 5 core digital skills. But there are also differences in infrastructure to deliver digital. So there are groups who will be disadvantaged in terms of this, but there are also local authorities where connecting digitally is more problematic. And in a review we did, we mapped where the challenges I referred to earlier around population ageing and changing family structures are more pronounced, and we overlaid them with where digital connectivity is also problematic, and found that there was considerable overlap in some areas. So there are parts of Scotland, such as Orkney and Harley and Shiar, and areas of Wales, such as Powys and Ceredigion, which are among the 20 local authorities with the highest proportion of people over the age of 65. But also having the most problematic connectivity with issues around 4G or next generation access, and the inability to receive internet at a speed that would allow you to connect digitally with the Internet of Things and other digital technology enabled care devices. So that presents a significant problem to the idea that digital technologies can be transformative for everyone who needs adult social care support. Digital technologies also bring other issues around the need for updated safety frameworks for technology-enabled care, and there's been considerable debate between the representative body, the Technology-Enabled Care Services Association, and Ofcom, the telecoms regulator in the UK, about what is a minimum safety standard for some of the battery backups for the newer digital devices. And the shift to mainstream within this move around digital also brings issues of ethics, data security and privacy, which I think James's presentation is going to really talk about later. Next slide, please. Next slide, please. I'm going to skip that one, I think. So with these issues in mind, and against the backdrop of the investment from government, we wanted to explore in a bit more detail what technologies were being deployed in adult social care services within local authorities, what the challenges they were experiencing, what the opportunities they felt digital presented. So we've conducted case studies with local authorities, which are still ongoing, and also stakeholder consultations. Next slide, please. So from the stakeholder consultations, we wanted to unpick what local authorities were really, what sorts of models were out there. And we found that in practice, although analogue telecare services should be being decommissioned, they are still the core offer in a lot of local authorities. And there were examples of pilots and some of the national funding being accessed to pilot new approaches and trial new technologies, but also local authorities freeing up resource to do this. So we saw examples where innovation hubs were being created either within adult social care or more broadly within local authorities, including little projects in adult social care. We saw examples of pilots to trial things like mainstream technologies, but also more advanced technologies like robotics, particularly cobots, which are exoskeletons that carers can wear while they provide heavy care tasks. And we also saw examples where 5G mesh networks and LoRaWAN networks were being used to enable digital inclusion, but also with a particular view to supporting digital social care. And there were also examples in our review and stakeholder consultations around local authorities aggregating data for modelling or preventative approaches. But as I say, lots of pilots, but there were some local authorities going beyond their short-term pilots to think about redesigning services and perhaps even redrawing the boundaries and lines of responsibilities between themselves and service users and providers and other groups. So, for example, some had moved away from a traditional local authority commissioning the kit from one provider or the technology-enabled care service from a provider, but actually having almost a middleman or brokerage service in the middle to do that sort of work for them and focusing that service on outcomes as opposed to, buying X number of a particular piece of kit and delivering that. And some had shifted to having a dedicated specialist or specialist team within local authorities to try and mainstream technology across all services, including adult social care. And there were examples where some local authorities were starting to think about themselves more as curators of knowledge around technology rather than actually necessarily providing it themselves. So trying to assist users in understanding the way they could use things they maybe already have in a sort of asset-based approach to deliver care outcomes. Next slide, please. And stakeholders, in terms of the opportunities being afforded by technology, there was examples of enthusiasm where they felt technology could promote choice, increase capacity, monitor wellness, and reduce costs. And And a particular area where across all the stakeholder groups were enthusiastic about was mainstream technologies and the ability of these devices to deliver well-being outcomes. And it was quite hard to tease out from any of the groups any issue around risk related to mainstream technology, but I'm sure James will talk a bit more about this. And we spoke across all stakeholder groups. There was enthusiasm for the use of data. There was the acknowledgement that within adult social care, a lot of data is being produced and not necessarily used to its best effect. And examples of where data trusts and aggregating data was being used to, at the macro level, to plan for preventative services, but also even at the micro level, helping to adopt a more preventative approach and reduce the need for care in a crisis. And in the discussion around opportunities, we also spoke about particular catalysts for action and that were being cited by stakeholders. So one of those was the digital switchover. That some local authorities were taking this as an opportunity to redesign their services beyond the simple substitution of an analogue device for a digital version. And some, as I say, going and investing in the infrastructure for digital, acknowledging that you need the plumbing before you can do anything else. And these stakeholder consultations were conducted in spring last year and then the second round in winter, so during COVID-19. And stakeholders were quite keen to emphasise how it had removed some of the barriers around technology rollout. There had been projects that for example, local authority commissioners had wanted to really start for a long time and almost overnight with COVID-19. Some of those barriers just disappeared, they said. Next slide, please. But there were some challenges identified that even with these opportunities that some stakeholders felt that there were some issues around technology, such as the confusing marketplace, knowing who to trust, and particularly with the shift to more digital, just the space being increasingly inhabited by startups who were very innovative, but questions as to whether they would have the longevity or the ability to support at scale. And there seems to be a bit of a shift away from some of those big telecare providers who have dominated that market for a very long time to the potential there for new companies to come in, perhaps. But this confusion didn't help with trying to change hearts and minds about technology, and there was some frustration from stakeholders about those making the decisions and how to persuade them, or those perhaps using technology on the ground, how to persuade them of its usefulness and efficacy, and what kinds of evidence they needed or what kinds of arguments they needed to leverage change was quite difficult to disentangle for them and quite difficult to produce. And the pilots that were being conducted were cited as a useful way to trial technology, but there were questions about whether they were sustainable and scalable and spread. And there was a question of pilot fatigue and pilotitis, the idea that nothing really gets embedded, it's just pilot after pilot. And almost counter to this area of digital, where there is a lot of innovation and fast change, you've got commissioning arrangements which are quite slow and inflexible, and this was a source of frustration for all the stakeholders, not just you would expect the technology providers finding that a bit frustrating, but the commissioners themselves found they couldn't be as fleet-footed as they would like. And a challenge was also the digital switchover, as much as it was a catalyst. There were some local authorities who felt that it was just too big a challenge for them to tackle on their own, and then it was almost a waiting game for more guidance or a roadmap from government or funding, or even just that perfect piece of kit that would answer all the issues around safety and reliability and change things for them. Next slide, please. So that was a very fast run through, but to conclude, adult social care services across the 4 nations are all facing challenges, and technology has been advocated as a sort of top-down way of mediating these challenges, but there are variations in the degree to which local authorities face the challenges, but also how they've approached technology in the past. And these policies and commissioning legacies and levels of expertise and investment are almost channeling them into different, almost ideal types with different levels of technology within their services and different approaches to it. And the confusing marketplace doesn't help that. The lack of evidence doesn't help that for those who've almost been left slightly behind to catch up. And we know the current core technology-enabled care offer of telecare via analogue systems isn't sustainable, and digital alternatives are being considered, but there are issues around sustainability, scale and spread. And what we then see is this very patchy local authority picture in terms of technology-enabled care. And what this then means then for service users is there are issues of inequalities and social justice. If there are technologies and being deployed in ways that deliver wellbeing outcomes and some groups are excluded, there are issues around justice. Equally, if there are some groups that are being unduly exposed to risks, again, there's a question there about fairness. And it reflects a broader issue in adult social care in the UK, where it's a very fragmented system, which on the one hand could make very responsive to the differing needs of local populations, but on the other hand, creates quite stark differences in experience potentially for service users. And that's everything there. So I'll just hand back to Matthew.
Great. Thank you, Kay, for that lovely presentation. I look forward to picking that up in the discussion later. Right, on to our second paper. Our next paper is from Maria Nilsson. She's a PhD student at Linnaeus University. Hello, Maria. Maria's paper today is entitled Older People and Informal Cares in Swedish Local Health and Social Care Policy for Assistive Health Technology. Whose interests do these policies represent? Over to you, Maria.
Yes, thank you for that presentation. I'm delighted to be part of this session. The study that I will talk about is the second study in my compilation thesis, in where I'm trying to increase the understanding on what the digital technology discourse in health and social care can tell us about society's view of health and well-being for older people and their carers. This study is conducted at Linnaeus University in Sweden. I'm working with Professor Elisabeth Hanson, Associate Professor Lennart Magnusson, and Senior Lecturer Stefan Andersson. And we are all active at the Swedish Family Care Competence Center, a research center at Linnaeus University focusing on all carers regardless of age, disease, diagnosis, or disability. Next slide, please. In this study, we aim to critically interrogate what we see as the technology solution discourse in local Swedish health and social care policy. The main concern of the analysis is the discursive construction of older people and their informal carers, and how the concept of health and well-being is constructed in these policies. Next slide, please. As you are all well aware, the central and dominant discourse in public policy and debate is purporting digital technology as the vital and necessary part of future care arrangements. In our study, we are using this discourse as the phenomenon in focus to study how older people and carers are discursively constructed and how the concept of health is constructed. Next slide, please. The two groups in focus for this study are older people aged 65 or older and their carers. It is, however, important to note that categories of age must always be seen from a critical perspective. It is rather problematic to talk about older people as one group with specific characteristics in common, when in fact it's including a span larger than any other period in life with subsequent large variations in people's physical, mental, economic, or social status, for example. The same being the case for informal carers. The geographic context for this study is Sweden, with its 21 county councils and 290 municipalities. Health and social care for older people are organized and provided mainly at the local level under the constitutional principle of local self-government. The municipalities in Sweden have extensive financial room for maneuver, and their responsibility for social care as part of the local self-government goes a long way back in history in Sweden. Although not that old, but emerging in the 20th century was the Swedish welfare state, which makes up the cultural policy context for this study. And as you all know, the Swedish welfare state is characterized by universalism, generous social transfers, and promotes social equality through a redistributive social security system. It thereby promises independence. Independence from other citizens and the so-called in-between institutions, such as family, charities, corporations, and the church. The social contract in Sweden, we can call it the State Individualism Treaty, has the need for independence as the driving force. We have chosen to analyze local policy since they form the governing programs for social care, directly affecting older people and their carers. Public policy is the determinant of health, as we see it. Next slide, please. So, we regard policy documents as cultural products and even political actors that define, organize, and transform health and social care. We based the selection of municipalities on the classification framework made by Swedish Association of Local Authorities and Regions. They are dividing the 290 municipalities into 3 main categories and 9 subcategories, basically from large cities in category A1 to rural municipalities in category C9. All documents that we retrieved were according to the principle of public access. And in this slide, you'll see the list of documents we asked for when contacting the municipalities. As you can see, we based our analysis on 68 policy documents from 8 Swedish municipalities. And I can have the next slide, please. Just a few short words on what method we used. Carol Batchy developed the What's the Problem Represented to Be method as a tool for conducting discourse analysis of public policy text. And previous literature has stated that this method is well suited as an analytical tool in the highly normative and complex social care domain. And the method is basically structured around 6 analytical questions to reveal discursive constructions and to uncover what is left unwritten, the so-called silences. I can have the next slide, please. And in the remaining time of my presentation, I will describe some of the results of our analysis. Just before I do that, let me remind you just again of the question in my title for this presentation. Whose interests do these policies represent? We could conclude that the discourse we call technology solution discourse was evident in local policy in resemblance to national policy as well. But while previous international research talks about promotion of technology entailing 3 winners, being older people, the society, and private investors and companies, in the Swedish local policy, the 3rd winner was not visible. The possible gains for the technology companies and investors were not mentioned, even though it's quite plausible to assume that the sector might have an interest in this large-scale implementation process that is ongoing. We spent quite a lot of attention on the so-called e-health strategies, with the assumption that these might be concerned with the concept of health. But the strategies mainly spoke about how to meet the demographic shift with an aging population and how to manage future shortage of staff. The technology was described as a tool supporting activity. But looking closer, what kind of activity was in mind? The policy exemplified exercise, gaming, social gatherings, or leisure activities. Activities like participation in the current debate, education, social responsibility, or environmental engagements did not seem to be the focus or offered for the group of older people. We argue that this might say something about how older people are thought about. I can have the next slide, please. In the policy documents, older people were constructed as being at risk for ill health, passivity, and consequently becoming dependent. The technology was promoted as a way of avoiding dependence on care, but the possibility that technology itself might lead to other forms of dependence on, for example, support centers or family, or increasing inequalities based on varying digital skills, were not highlighted. The carers in these policies were constructed as co-clients, meaning they were considered another group at risk for ill health and therefore in need of support, or as resources for the older person. And this comes as no surprise to you, I'm sure, since these roles were described in the classical work by Twigg and Aitken already 20 or even 30 years ago. Next slide, please. What may come as a surprise, though, is that technology was not promoted as a solution in the specific documents describing support for carers. In these documents, the telephone was the most advanced technology described, something we see as a contradiction. Okay, the next slide, please. And finally, I have some short reflections. First, concerning older people. Recent research states that primary prevention strategies focusing on proximal factors, such as a healthy diet, for example, have appeared to benefit only the most advantaged. In Sweden, just as in other European countries, inequalities in health prevail. Despite this, the responsibility for health in old age in these documents appears to be placed with the older person, as you can see in this quote. An important task is to facilitate for the individual's own planning and responsibility for the person's aging, and/or based on his or her social environment and/or disability. This quote is from a municipality from Group C9, which is the most rural municipality. If I can have the final slide, please. I will now make my final point, so if you bear with me. Previous research has shown that chronic illness and disability affect people in lower socioeconomic positions at an earlier age. So that would suggest people in disadvantaged areas are taking on caregiving responsibilities from a younger age. It is also possible to assume that being an informal carer might have a more detrimental effect with worse health outcomes for people from disadvantaged groups. This assumption is made possible if we use the concept of differential vulnerability as described by Digitising and colleagues, meaning that the effect of one given risk factor are likely to be stronger in groups with lower socioeconomic position. Yet, any form of inequality affecting informal carers remains a silence in these policy documents. And with that final slide, I end my presentation. I thank you all for listening, and back to you, Matthew.
Great. Thank you, Maria. Another great presentation from the team for this panel. So thank you very much for that. Now I'd like to introduce you to our third and final paper for this session by Dr. James Wright. James is a research associate at the Turing Institute. And in his paper today, he's going to talk about AI in adult social care, virtual assistants, and the changing role of local government in England. Over to you, James.
Great, thanks a lot, Matthew, and thanks for having me on the panel. So my talk today is based on an article recently published in the International Journal of Environmental Research and Public Health, which in turn was based on research that I did as part of the Sustainable Care team in 2019 and 2020 with Kate, looking at the role of technology in adult social care in the UK. So in this talk, I'm going to kind of riff off Kate's earlier talk and focus on one particular area of findings from that piece of research related to voice-controlled virtual assistants and particularly Amazon's Alexa, delivered through smart speakers such as Amazon's Echo and Dot, as well as through smartphones and tablets. So drawing on interview data, I'm going to look at how virtual assistants were being implemented in adult social care by some English local authorities immediately before the pandemic started and during its early stages, and some of the implications of more widespread adoption in England and elsewhere. Next slide, please. So I'll very quickly run through some background on the situation of adult social care in technology in England, for those who may not be familiar with it, although Kate's clearly done a great job of talking through some of this already, so I'll keep it quite brief. The current care technology landscape is dominated by telecare, the implementation of which was accelerated by the Preventative Technology Grant, which was the central government investment of £132 million to fund the widespread implementation of telecare by local authorities in England between 2006 and 2008. As Kate has mentioned, that generation of telecare was analogue, connected to fixed phone lines, and not much has changed in terms of the core functionality of the majority of the most basic telecare equipment, which is if you need help, you press an alarm button and you get connected via your phone line to a person at a usually local call centre who'll provide assistance. Of course, new technologies have come along since then with the digital transformation, but the care sector has been fairly slow to change and adapt to new possibilities offered by digital technologies. I think there are various reasons for this. Partly the nature of local authority commissioning processes. As Kate mentioned, some of our interviewees talked about their frustrations in the speed of commissioning processes. Also regulatory standards for telecare equipment, which presents quite a high bar for people trying to break into that market to provide equipment. Also the fact that a small number of big telecare companies have forged close strategic ties with local authorities, as well as clearly the increasing complexity of new technologies and a corresponding lack of technical skills amongst some employees of local authorities working in adult social care. And finally, a lack of authoritative evidence for new technologies on which to base commissioning decisions. Over the last decade, as Kate has also mentioned, local governments also had to deal with austerity politics, with local authorities in England making real-term cuts to adult social care, totaling £8 billion between 2010 and 2019. So if we fast forward to the last few years, we now have the added complication of the looming 2025 deadline for switching off analogue phone lines and switching them over to be fully digital. Kate's written about some of the implications for telecare, notably that a large proportion of existing telecare infrastructure will stop working on or before the switchover date. And this means that quite a large proportion of existing telecare devices will have to be retrofitted or replaced in order to continue to work. And Kate notes that this is estimated to cost between 150 and 300 million pounds. But this time around, there's no national government funding scheme like the Preventative Technology Grant to fund that adaptation. And the result is that some local authorities are completely prepared for the switchover, whereas others, their plans are far less clear. But pretty well all local authorities are now looking to technologies to make financial savings in care. So next slide, please. So to explore what technologies were being trialled in adult social care, between March and May last year, I conducted semi-structured interviews with employees from 8 different English local authorities who played a significant role in commissioning, trialling and working with digital technologies used in the provision of adult social care. The interviews were between 30 and 60 minutes, conducted via video calls, in one-on-one and also a few group sessions. There were clearly a lot of results from these interviews, but in this talk I'm just going to focus on one particularly striking finding, which was their near total convergence around the trialling and use of smart speakers and tablets with voice-controlled virtual assistants, and specifically Alexa. So next slide, please. So I'm due to the time constraints, I'm going to mostly skip this slide, but I've provided some references for anyone who wants to follow those up. I just want to focus on the fact that much work on AI, artificial intelligence in the public sector has focused on administration, planning, and management of services, algorithmic decision making. And there's been less focus on the deployment of technologies that incorporate AI, like we find in Alexa, on the delivery side of care. So next slide, please. I won't run through all of the functionalities of virtual assistants, which you might already be familiar with, but I just want to draw out some of their perceived advantages in care, many of which were mentioned by interviewees. So Alexa was released just over 6 years ago in 2014, and it's since become a commonly used consumer technology. Virtual assistants like Alexa are designed to be widely accessible, have sophisticated and powerful speech recognition and natural language processing. Smart speakers that deliver them are fairly cheap, and they have a growing level of interoperability with other network digital devices or smart devices. Additional apps, or skills as they're called for Alexa, are being continuously developed and made available to users. And as popular mainstream devices, they avoid the stigma of beige telecare devices and other go-on technologies on which developers may have inscribed negative stereotypes of aging and care. So virtual assistants seem to embody a more consumer-oriented, smarter provision of technology to deliver on the promise of independent living, with Alexa becoming a kind of substitute caregiver or companion that can empower users who require maybe only moderate levels of everyday support. So next slide, please. So how has Alexa actually been used by local authorities? Representatives from 7 out of 8 of the local authorities that we interviewed said that they were using Alexa-enabled devices in ongoing trials, and in one case as part of their standard telecare offering. Some local authorities were attempting to develop their own skills, including a medicine reminder, a skill to record and manage care tasks, another to record messages for caregivers, and another to connect users to a trusted local authority directory of services. Others used existing Alexa skills, like the ability to control other smart devices like lights and thermostats in people's own home, to try and reduce the number of in-person domiciliary care visits that users required. Several interviewees, notably, repeatedly talked about Alexa being a potential replacement for existing telecare, a kind of next generation that would be far more powerful and with greater functionality. And one deputy director of commissioning suggested that if Alexa put a SIM card into their Echo devices, they'd effectively destroy the traditional telecare industry. They said that if this didn't quite happen directly as a result of the impetus created by the 2025 digital switchover, it would happen in the near future. So at a time when adult social care funding in England is in crisis, and the care technology market is more fragmented and complex than ever before, while existing telecare looks increasingly old-fashioned and basic, the familiarity, convenience, and low cost of smart speakers made them seem to several interviewees a quick and easy way to upgrade smart services while reducing council spending, particularly on home care visits. So next slide, please. But not all local authorities were as tech savvy as the ones kind of mentioned above. While some local authorities had specialised roles devoted to applying technologies to adult social care, others had far less experience and were unsure how useful Alexa would be, or even how to use Alexa. And as Kate mentioned, different local authorities are also facing different challenges. Another obstacle was that many interviewees mentioned was that Alexa devices were usually not being directly offered by local authorities to adult social care service users. Local authorities tended to encourage service users or their families to purchase an Alexa device or use one that they already had to take part in local trials. And this was really key because it enabled local authorities to sidestep highly complex information governance issues, because the user agreement for the device was a consumer agreement between Amazon and their customer. As one director of adult social services put it, quote, "We're just relying on the consumer relationship. We're not getting in the way. For me, it's part of the answer. It's utilizing ordinary universal things that connect families with vulnerable people so they can check on one another and care for one another without us coming into the equation necessarily," end quote. In fact, another interviewee explained how their plan to develop their own Alexa skill had failed precisely because of information governance issues, suggesting a degree of not just technical but also legal complexity that might discourage local authorities from actually developing their own skills. There are also issues of digital divide and reliability. One issue is clearly who can afford to buy a smart speaker. And also, unlike more traditional analog telecare devices, smart speakers are vulnerable to power cuts, internet outages, network slowdowns, internet or Wi-Fi equipment failures, and not to mention hacking and cyber attacks. And several interviewees also mentioned their ethical misgivings about giving Amazon potentially access to data about service users. So next slide, please. So looking at the application of AI at the local level in adult social care reveals a number of opportunities, but also concerns as new, more complex care assemblages come to include a fragmented patchwork of consumer electronic devices, bringing together a fast-moving global consumer technologies marketplace with, as Kate has described, the slow commissioning practices and long telecare contracts of local government. Perhaps more fundamental is the risk of increasing public sector reliance on precarious corporate infrastructures for the well-being of older adults under the care of local authorities, and a misalignment of priorities between local government and global technology corporations. And I call it a precarious corporate infrastructure because, Alexa has only been around for 6 years. And there's no guarantee either that it will still be around in another 6 years, or that other smart speaker hardware or software will continue to be supported into the future, or that user data that's being collected won't be sold to other companies or used for new purposes. Just to give an illustration of some of the issues. So one deputy director of commissioning told me that they trialed a Samsung smartwatch with older people in that local authority to monitor different types of physiological data. And while they were doing the trial, Samsung released a minor software update which stopped all of the watches from working. And it was quite a simple update to solve the issue, but the people that were using the watches weren't able to do it for themselves. And the council didn't have the resources to be able to visit everybody individually and update their watches for them. And obviously it wasn't a priority for Samsung. The interviews also suggest how local authorities see their role as transforming in a situation of prolonged lack of funding. We can see many local authorities creating innovation hubs and specialized technology roles. From the interviews I conducted, it seemed that local authorities were not just piloting virtual assistants like Alexa, but also in a sense piloting new versions of what a local authority could be. where they take a step back from a direct delivery of services and become more like an app developer or a data broker rather than a commissioner of social care services, becoming more of an intermediary between citizen consumers and powerful technology companies. And there's this great quote that Kate also used earlier, where one interviewee said that he saw the future of local authorities, the role being as curators of knowledge, not deliverers of services. So in this new care ecosystem, public services like adult social care could become increasingly incorporated into a supranational commercial app ecosystem controlled and owned by monopolistic global technology companies, kind of reversal of the previous system where the government created the national or local commercial ecosystem for private companies to provide services. And this further suggests that there could be an accompanying loss of power and control, including over what's emerging as one of local government's most valuable remaining assets, which is citizen data. So to conclude, the findings suggest an urgent need to come up with a coordinated social care technology strategy to understand these longer term risks and figure out the best approach to such technologies, rather than continuing to make it the responsibility of local authorities or even individual consumers before Alexa becomes critical infrastructure on which adult social care depends, as, for example, Facebook has already become in other areas of public services. So that's the end of my talk, and I'll hand back to Matthew.
Great, thank you, James. That was a great talk. Looking forward to picking up on the discussion. So thank you once again for that. And that is the end for the papers for this session now. Now I'd like to pivot over to the next part of this panel, which is the discussion. And we are delighted to invite Simon Bottery, Senior Fellow in Social Care at the King's Fund, to this virtual stage now. Thank you, Simon, who will now make some quick remarks about what he thought about these themes mentioned by these presentations. Over to you, Simon.
Thank you, Matthew. And those are certainly three really interesting and quite different presentations, but I think with some common themes, it seemed to me. I'll try and do justice to what people were saying and hopefully not try and not misconstrue anything that they were saying. So I'll pick out two or three things from each of the presentations, try and identify sort of common themes, and then raise some questions that the presentations sort of certainly raise in my mind. From Kate's presentation, I thought, one of the key things that came out for me was this whole thing about, context being king. So Kate talked about sort of wide variation in the approach that local authorities take, in the policies, in the funding background, in the financial capacity. But she also talked about differences in the extent of infrastructure within local areas and differences in people's individual skills. So the context into which you might introduce one or more things varies really significantly, both in terms of the geography and also the individuals within that context. And I think that was one of the things, again, that comes out in some of the other presentations. Kate raised issues around a familiar theme around cost effectiveness of technology. And again, if you've been around this sector, you know that very often technology is thought of in the context of, is this a way of saving us money? We've got reducing budgets. Can we save money by introducing technology as a replacement for something? So immediately you've got an expectation of technology and what it can achieve for you. So that issue of cost effectiveness came out in Kate's presentation. Kate also, I think, just touched on a definition. So she talked about, sort of AI, data analytics, robotics. So, already quite a broad definition. And this is one of the things I think it's worth coming back to in some of the questions. Kate also talked about a familiar theme of lots of pilots and trials underway, and some of them perhaps not, entirely conclusive. Although she did, in fairness, talk about, some local authorities thinking about sort of system redesign and moving towards that direction. And then when Maria spoke, it seemed to me she did something very interesting, and she essentially turned the telescope around a bit and said, well, actually, let's look at this not so much from the perspective of the technology itself, but what's the language used about technology? What's the discourse? And what does that tell us about our attitude in society to older and disabled people fundamentally? So a really interesting and different sort of approach. And of course, in a different context, because we're not just talking about a different local authority here, we're talking about an entirely different country and with a different approach to social care. Maria, I think, was the first person to raise the question of the providers of technology and essentially what's in it for them. And they're not necessarily discussed, and we're not necessarily thinking about them when we're talking about technology. But actually, what is the role of the provider, and are there issues there that we need to be aware of? And Maria also flagged, and this comes from, I think, out of variation and context, talks about disadvantage and health inequalities, and for example around carers and about the inequalities that they might experience. So a really interesting presentation, quite different from Kate's. And then when James spoke, so he focused on a technology that many of us will be familiar with in Alexa, and so in some ways that's quite reassuring because we know what it is, and certainly when I'm talking about data analytics, I'm still struggling to think what do I actually mean by that. So we've got a very familiar theme and a very familiar product in Alexa. James talked about, the sense that the care sector has been slow to adapt to technology, and certainly that's a pretty coherent and regular theme in a lot of the things that I see and read about technology, that somehow this isn't happening as fast as it ought to be. And I went to a presentation recently where someone talked about the number of startups in social care in technology, and they said, there was about a tenth of the amount that they would have expected. So there's something about social care not having seemed to get to grips with technology in some way. And partly that's because one of the other things he talked about, which is this thing about evidence, that we lack the evidence for the benefits of technology. And I guess if you start from a process of thinking, well, actually this is about cost effectiveness, and that's your focus, then that gives you one particular bit of evidence that you're looking for. But we've always been quite not effective in social care about looking at broader issues around well-being of individuals and outcomes for individuals. So if we haven't got the evidence for that as a result of technology, that's nothing unusual, because actually in social care we tend to struggle to find that evidence anyway. James picked up on something about, well, what's Alexa supposed to be doing? What's it actually doing? And James will tell me if I got this wrong, but broadly what I was understanding was from local authorities, the feeling was that this was something that allowed a relatively low level of support to individuals and their families, and allowed them to interact and perhaps sort of support each other. And it raised for me a question about, well, what is the technology? What are we actually aiming to achieve with it? Does one product have the same amount of value for someone with very high levels of need and very complex conditions, or perhaps someone in a nursing home, as it does for someone who has relatively low levels of need? He said something very interesting about the assumption being that people would use their own Alexa. And that got into a really interesting discussion about, well, what is the role of a local authority then? And a long discussed sort of sense that local authorities move away from being a provider of services and move towards more being an enabler of services and a facilitator of services and a facilitator of support. So that's again a really sort of constant theme that you hear. So really, really interesting presentations. I came out of it with 4 questions that I think I'd like to put back to people in whatever order. The first question is, are we talking about one thing? So when we're talking about technology or we're talking about digitization, is it really one thing? Is robotics really the same as Alexa? Is telecare really the same as data analytics software? So are have we actually got something which is actually much broader, really, and that we're not really talking about one thing? Or could we actually sort of put a line around it and say, yeah, that's what we mean, that's what we're talking about? The second question was, in whose interests should we be looking at technology and thinking about technology being used? Are we talking about the interests of the commissioners, so local authorities, or whether that's in the UK or in Sweden? Is it the interest of the user, the person that's actually has a disability and needs support? Is it the interest of their families? Is that where we should be focusing or thinking about? Is it the interest of workforce? For some technology will actually convert significant benefits on the workforce, or is it in the interest of providers? And we raised that question about whether providers, whether we're thinking enough about what providers are getting out of this, and should we have a degree of concern about that? So that question of who in whose interests and who are these products actually really for? The third question was, going back to what James says, is where is it most likely to have impact? Is it at the relatively low level of support, sort of helping people stay connected to a wider community, or is it actually at a much higher level of need? That person in a nursing home. Where is the greatest opportunity and greatest challenge, but mainly opportunity that people talked about in their presentations? And then finally, and I think we can't sort of get away from this question, because I'm really conscious that we're having this conversation today. We're staring at our computer screens. We're sort of typing away, and we're using technology in order to communicate with each other. And we're doing that because we've been forced into this situation because of COVID. So what has changed, or what potentially does change as a result of COVID? Because in some areas you can see that technology is being used for people to do remote assessments, for examples, and there's lots of stories of people giving away iPads to people in care homes so they can stay connected. So COVID has fundamentally changed some things, at least temporarily. And what impact does that have on the presentations, whether that's the opportunities challenge, the contest, or the discourse, if you like, that our presenters had talked about? And I'll hand back to you at that point, Matthew.
Great, thank you, Simon. Some great discussion points there, and also some great questions being raised as well. So thank you for sharing that. Before I turn over to each of the panelists to respond, I just want to make a general observation as well. And again, thank you to Simon for your questions, discussion points, and also to the speakers for their presentations. One thing I was reflecting on was how much the findings and analyses from the speakers relate to the construction of the welfare state and how it reflects policy and provision of digital technology for both supporting people and also care systems. So a really famous scholar in this area is Espen Andersson, looking at welfare states and how they're classified, using really three kind of broad categories. So you have the liberal states, which is kind of exemplified by states like the US, but also the UK as well. The corporatist conservatives version, which is kind of very Germanic in so many ways, but also represented by other kind of European nations as well on the mainland. And then you have the social democratic, which is represented by the Nordic countries, including Sweden. So looking at Swedish as an example of a social democratic welfare state, and the UK as a liberal welfare state, I thought it was interesting how in Maria's presentation, she really teased out that in the policy discourse, there wasn't a lot of information about identifying producers or investors of technology. Conversely, in a lot of Kate's presentation, the UK had a very prominent role for tech providers, looking at ways to resource technology within the care systems, but also how to fund new tech investment as well. So I was wondering, something we maybe think about is how will the digitization of the welfare state transform public services and our ideas of that welfare state in due course. But as you're reflecting on that, I want to go to each of the speakers first to respond to comments and questions raised by Simon. So I'll go in the order of the presenters. So now that you're all back in this main room together, Kate, would you please respond to the comments from Simon.
Thank you. Yes. Yeah, the first comment about context being king, absolutely. There's a huge range of different approaches local authorities were taking, and almost the path dependency of policy forcing them in certain directions. And I think that complexity, I mean, Carl May just tweeted just before this saying that implementation isn't rocket science, it's more complex than that. And I think that is key, like the complexity of local context really drives the way policy is going. And I don't know what the answer to that is in terms of top-down policy isn't the way, but then local authorities are crying out for some top-down policy around the digital switchover, and I don't know how we resolve that issue really around technology. And the second point was around cost effectiveness, and I think that's a really interesting issue, and the sort of assumption that technology can replace people and save money and increase capacity kept coming up. The way this is going to increase capacity, but James highlighted a really important example is technology creates new roles for people. It may shift certain tasks away from certain people, but it does create new roles, and you have to be able to resource those roles. So if you're going to give out Samsung smartwatches and they need updating, someone's going to have to go and update them. So the idea that it can be quite short term and narrowly focused, and it doesn't consider the long term implications of some of these things. And some of the local authorities haven't really considered the cost effectiveness of some of these devices. There was one local authority who wanted to pilot Alexa, assuming that everyone they would give it to would have broadband already in place. And when they didn't, they found their... Sorry, my Alexa's just answered me now. They then went to go and try and deliver these devices, the A words, and then they got into a whole quagmire of, okay, we want to do this pilot, so we're going to have to pay for your broadband contract while you're in. And it just became, yes, I can see where it can create cost effectiveness, but at the same time, new roles, new responsibilities, new lines of risk, and it poses more questions than it answers perhaps sometimes. The definition question, what is technology? And I think this is one of the big talking points as well as from my presentation. I think it's expanded through practice to what is included in technology-enabled care services now. Before, when we set out to do this sort of scoping, mapping, the stuff around digital infrastructure and local authorities investing in that wasn't necessarily in scope when we first began this, but it became apparent that it was being sort of brought into the adult social care agenda for some local authorities. They were getting funding to create the digital infrastructure to then use the digital technologies in adult social care. And I hadn't considered that to be part of adult social care technology, but it is an important part for some of these places where the connectivity is challenging. And the question of pilots, yes, being not conclusive, certainly, yeah, and not just in this piece of work, but in other pieces of work in sustainable care, hearing about pilots that had gone not as planned, and we were not allowed to talk about that anymore. And there's lots of learning there, but it's not shared and it's not scaled and it's not spread. And then there are local authorities making similar investment and doing similar things and finding the same sorts of challenges. And even within local authorities, the lack of recording of these things and institutional memory. We spoke to one who were looking to invest in a piece of equipment and were about to purchase it, and then found out there was a whole lot mothballed in storage somewhere that had been trialled before and it had not gone well. And the idea that just pilot after pilot and not really gaining traction was certainly a challenge. And turning to the big questions that were cut across, the definitional problem, absolutely. Discourse and policy sort of treat it as one thing, but there is increasingly a plethora of different technologies within technology and adult social care. And the thinking from a science and technology studies approach, that even if you focus on a very specific piece of kit, say the A word in adult social care, the context within it's being used, how it's being used, who it's being used by, mediates how it functions and the outcomes. It's more of a dialogue than a fixed thing. And I think that also relates to the different outcomes we're seeing in different local authorities as well, because although they're all trialling the A word, they are using it in different ways with different groups, with different people, different stakeholders, and engaging them differently. And as a result, you're seeing different outcomes. So I go to the question of whose interests. It's very interesting. Ideally, it should be users, shouldn't it? But for a care system to be sustainable, as our approach on sustainable care is taking, is it needs to be in almost everyone's interest. There can't be anyone whose well-being is being neglected, otherwise it's not sustainable because it's exploitative in some way. And trying to find that overlap of equipment that can generate good outcomes for everyone is quite challenging. And there were certainly examples of where we saw technology being used in ways that was certainly beneficial to, say, a provider, but not necessarily for a care worker, or not, there were these tensions, and I think they definitely are something that could be teased out through research. And COVID, what has changed? And what will go back? And I think time will tell on that. There were some, so for example, we spoke to a platform provider who there was still an element of human interaction in what his company had been doing prior to COVID. There was still face-to-face training, there was still face-to-face onboarding. That all had to stop with COVID, and they're not going back because they don't see any value added in going back to the face-to-face. But I think one of the challenges is around the issue of impact and evidence, and because of the fast pace of change that had to happen because of COVID, there isn't that evidence base been generated, and trying to get sustainability for some of this change, whether positive or not, might be more difficult, but also trying to get rollback potentially might be difficult, because if you can't show that it's had a good or bad impact, it may become entrenched, or it may be rolled back as we return to whatever normal is post-COVID. So I think time will tell on that one, but yeah, those are my comments.
Great, thank you, Kate. That was a fantastic response. Really helpful, giving the additional insight into how you're kind of looking at those definitional questions about who's ultimately benefiting, look at kind of almost social justice angle too, and adult social care, right? Looking at, we're not exploiting certain people, looking at everyone's well-being in that care ecosystem. So thank you for that. Maria, over to you now to respond to Simon's remarks made and questions raised as well, please.
Yeah, well, I thought it was very interesting to hear those reflections, and I was quite pleased that you thought I'd turn the perspectives around. That was a little bit my attention, because I find this discourse in need of much more attention, much more investigation, really, because I think it's used in a quite uncritical way. And as we've discussed here previously, we talk about older people as users, for example, or users or even customers sometimes, I think, when I think that it might need to be discussed more that they are still citizens and sometimes with care needs. And are users the same thing as that? I think that's interesting to look at more in this area. And as well, you said the providers that I'm in the Swedish policy documents, they are not visible. And as you said, Matthew, I think that has something to do with the system that we have, the Nordic welfare state. As you said, Andersson did a very good job doing that division. I think it's been further developed. I think it's even 5 different groups now, given the South European systems and so on. So, and I think you have absolutely right there. It's something here we need to check how this different welfare systems is evident in the discourse around technology and care. I think it's a good frame for understanding it better, really. And you also brought up some of the disadvantaged areas and inequalities. I don't know how the situation is in the UK, but in Sweden it's not talked about at all. It's as though it's not existing. And even though I know we have not those those kind of inequalities that exist in some European countries. We have them in Sweden as well, and unfortunately they are increasing. But it's not visible in this discourse at all. It's like everyone has the same opportunity, the same skills, the same economic possibilities, and so on. So I think it requires further reflection there as well. And for the overall questions, as you see, are we talking about the same thing here? I think probably not. I think it's really hard to try to pin down this area, and it's constant moving targets all around. What are we discussing here from one side of, as you say, AI and robotics, and on the other, this really, 100-year-old technology of telephones that are still in use. So it's really hard to find the definitions used. At least I haven't come up with something that's working for me yet. So it's still to come. And in whose interest should this technology be? And I've thought about it. I think looking at the discourse, at least in Sweden, it seems like it's mostly as a savior for the society, really. The society in risk of being overwhelmed by this demographic shift that we're into. So it's here to save us all, really. That's really how I see the interests, the society's interest, which can be discussed, of course. And I think it's a very interesting question, this, how the COVID has affected things, what has changed. In Sweden, I would say it has really brought up the issue of social care for older people up on the agenda, because before COVID we were discussing anything else, problems, but not the older people, and social care was not really up on the agenda. And with the pandemic, everyone is suddenly having an opinion about older people and how the lacks of social care. And we've also seen, for example, in the media, we are placing out pictures from the hospitals and showing how well equipped we are in the hospitals, but we have tended to forget the municipality level social care, the residential homes where the older people stay. For some reason, it has not been in the media the same way. And I think we've started to reflect on that as well. What are those differences pointing to? Is it a hierarchy, and is it more high technology in the hospitals that we are focused on? Look at the doctors, the nurses, and high technology, what we can do. And we tend to forget the residential care, the people working there every day, the hierarchy. I think many people talks about it's a matter of class, really, to the end of that. So I think that was my reflections for now, and I can get back later. Thank you.
Great, thank you, Maria. Very evocative examples given there, especially related to COVID-19. We'll pick up on those again in a little bit. James, over to you for your comments, reflections related to remarks raised by Simon.
Yeah, thanks a lot for your comments, Simon. Yeah, like Alexa as being a very familiar product, I think, that is a major selling point for local authorities. I think Alexa is not just accessible for users, but it's actually accessible for the people that work for local authorities. It's understandable and graspable. And I think, in this situation that, Kate and I have described, maybe I think a lot of local authorities are almost desperate to find something that can save money, that can also at the same time appear to be improving services and providing a smarter kind of service. In terms of the care sector being slow to adapt and change not happening as quickly as it should be, Yeah, I mean, in the interviews that we did, I think there was only, and Kate, correct me if I'm wrong, but I think there was only one local authority that had a specialised senior role with somebody who's very senior in the local authority, purely devoted to looking for applications of technology in adult social care. And that local authority was hoovering up all of the funding, or not all of the funding, but a lot of different funds related to digital care, technology and care. I think there are a lot of reasons for that, for why the care sector in general has been quite slow to adopt new technologies. I think care has been constructed in public discourse and also structurally in kind of opposition to high tech. I think that based on the interviews that we did, a lot of people working in social care kind of didn't think of themselves as being really interested in technology very much. And it was striking that they often described themselves as being amateurs when it came to technology, even when that was actually their role. Their role in adult social care in their local authority was to be the technology person. And I think as a result, also structurally in terms of the funding crisis in care, it's not really surprising to me that there are so few startups, because if you're starting a company, I don't think the care sector would be particularly attractive because of the lack of funding and also the regulatory obstacles to overcome, and in terms of dealing with local councils that are trying to cut costs. So I'll move on to some of the questions, the other questions. In terms of the definition of technology, I think we were looking at quite a broad definition, but focusing on digital, a family of digital technologies. I mean, I think Alexa and robots are very different, but at the same time, they're driven by the same core technologies that have really boomed in recent years. Obviously, big data, statistical techniques associated with AI, analytics, improved processing speeds, the spread of internet infrastructure, and various other things. And I think some of the ways that we could think of them as forming part of the same whole is that they do raise similar issues, and we talked about some of them: digital divide, issues around data governance, security, privacy, the need for training and education, and also some of the same issues that they raise in terms of shifting responsibility. I am kind of interested, although I haven't really worked as much on this yet, but the way that new digital technologies, especially in public services, could enable responsibilization, shifting the responsibility, actually, as Maria was talking about, to kind of individual consumers. And also the other issues that they raise, obviously, are things like the creation of lots of different quasi-invisible tasks, like the need to maintain apps, do updates, store equipment, recharge everything, troubleshoot random things that come up. I think those are new challenges associated with these new digital devices or digital technologies. So I'll just pick up on the COVID, what changes as a result of COVID and how lasting it is. I mean, looking at it from the perspective of Alexa, you would think that smart speakers would have become a lot more attractive. And obviously you have Matt Hancock giving away 11,000 iPads to care homes, which I think you referred to. I'm not really sure that any of that changes any of the arguments that I'm making, or in my talk at least. except in making them more pressing, because now there are a lot more of these devices in circulation. And I mean, I would be very interested. I think it's probably another piece of research, but to understand, what has actually been the effect of increases in devices, and whether the uptake of digital has really happened. I mean, in the interviews that we did, so I did some interviews right at the start of the pandemic, and there was some of the interviews were saying that a lot of the obstacles had just been completely removed. There was a lot of funding suddenly and uptake, and whereas previously they'd say, well, we have to do something in 6 months' time to accelerate digitization, they were saying, okay, we have to do it in like 2 weeks. I'm sure that had a huge impact, but then interestingly, slightly later on in the year, I'd done another interview with a technology device supplier who said, yeah, we had a big bump initially, but now actually it's kind of trailed off, and there's less interest. So I don't really know the picture, and it would be really interesting to do some research around that.
Great. Well, thank you for those remarks, James. We'll now move on to a wider discussion now. So what we're going to do is we're going to, again, unsurprisingly, go to each of the speakers again in the same order, starting with Kate, then Maria, then James. And I'll ask the other two speakers to ask their questions to that speaker, if that makes sense. So basically, I'll ask Kate, we'll work out with Kate first. Maria, I'll ask you if you have any questions for Kate. James, if you have any questions for Kate. And then we'll respond to those as well. As the chair, I'll take the chair prerogative and start off the conversation. So it gives you time to think about your questions as well. Kate, again, thank you very much for your presentation. It's fantastic seeing what the Sustainable Care Program has come up with so far in relation to technology and care systems. So thank you for the presentation, first of all. One thing I was reflecting on is how the data you had and how it reflects the kind of limited infrastructure available in certain regions and localities in the UK. I think you skipped over the slide that had the really fine granular detail about it, but you still mentioned, some of the locations in the Outer Hebrides, some remote and rural locations in Scotland as well, and also parts of Wales and England, having relatively little access to 4G technologies, limited broadband access. And as we still have policy that focuses on place-based solutions for caring and aging, indeed this whole session is about place-based caring, how would you recommend policymakers attend to these infrastructural inequities across these geographical boundaries, right? So whether it's from local policy, regional, or national, how would you direct them trying to address these kind of infrastructural inequalities?
That's really interesting. Yeah, so there was a slide I skipped over, quite a colourful one, which sort of outlined the areas of the UK where access to reliable, good digital connectivity was problematic, plus there were the issues around population ageing. And in our interviews and case studies, we've spoken to local authorities where issues around connectivity were acute, and they had implemented policy and practice to try and ameliorate that. So there, for example, is Liverpool, which received initially European funding and then DCMS funding to roll out a 5G mesh network in some of the poorest wards in the city. So the issue was around people having access to free connectivity. It wasn't necessarily that the infrastructure wasn't there, it's just people couldn't afford to access it, and that's what they did. So they have, in some of the wards of the city, free connectivity to 5G. And the rationale for this was around digital inclusion, but also around the fact that it would enable care providers to be able to connect to these 5G mesh networks to enable real-time reporting when out doing care visits. Because increasingly local authorities require of care providers to have some sort of digital record keeping. And this obviously knocks a cost on then to the care providers to be able to achieve that. So having broadband, having tablets, having all these things to enable that to happen. And that local authority acknowledged that was a problem and then invested in it. challenge then is making that sustainable and making the business case for that, and that is what they're working on. So that is the challenge. When local authorities are investing in this, then they have to try and make it sustainable, and there are other areas of the UK which are doing LoRaWAN networks and other things to run Internet of Things devices, and the benefit being that the data generated on those networks then belongs to the local authority. And as James said, data is actually quite a valuable thing, and we, giving it away to Amazon seems a little short-sighted. But then again, challenge, sustainability, scalability, how we do this. But it's really clear from the interviews that there was a desire from local authorities for investment around the digital switchover, but it wasn't forthcoming in terms of national funding. And we know that digital connectivity, because it has been left to telecoms providers, has tended to focus on most populated areas of the UK. So that is why we have a patchy connectivity picture. That is why there are areas that are poorly served where they are rural or, not densely populated. And if we leave it to those companies, it may never happen. But however, having said that, two of the largest telecom providers are creating LoRaWAN networks. It's just whether local authorities want to leave that to them or would like to provide their own and then have that data. So those are the challenges, is being able to make the case for that investment, because it is an expensive investment, make the case to make it sustainable. But part of that is connected to the benefits of the data generated. But if not, it will be provided by the telecoms companies eventually. You just might have to wait. It is the challenge. But national government, it would be great if there was something forthcoming, but it doesn't seem like there is a sort of going to be a central pot of money for that to make it. And in any case, it would then be up to local authorities to make it sustainable at the end of the day, wouldn't it?
Yeah, great points raised. Thank you, Kate. Maria, do you have any questions for Kate?
Yeah, thank you. Yes, I was thinking about, you mentioned this data produced but not used, you said, and I'm quite familiar with that here in Sweden as well, where the staff is not really used to getting all that amount of data. And I wondered if there has been some kind of ethical discussion. I mean, I think it is an ethical issue, really, when people come with their data, but there's no one there to look at it or interested in it, or has there been some kind of response to that?
In terms of the ethics around asking people for data and then not using it,
yeah,
I think there's certainly a frustration for service users having to repeatedly divulge the same information across the various different, and COVID has accelerated that, with some areas moving on with shared care records to try and move beyond having to keep reiterating the same data. But then there have been discussions here around ethical issues of this sort of aggregating data and what then that data is being used for, particularly in children's services, around prediction and decisions made on that data and what that means for people at the end of the day. And this is probably something that James can talk around AI and ethics and of that being used to mine data, perhaps, I don't know. But yes, certainly it does draw up a whole range of ethical issues. But as James raised, I had anticipated in the discussions around the use of smart speakers and the implications for data that local authorities would be a little more cautious than they are, and they didn't seem that cautious. They sort of very much felt that if this was a consumer relationship, even if they'd recommended a person enter into that consumer relationship, it wasn't really their responsibility to make sure users understood what was happening to their data being generated and collected by a smart speaker. And researchers found that people really don't have quite a poor grasp of what happens to their data when it's being used by a smart speaker. And that is perhaps the worry then, is that the responsibility and risk is being shifted onto the individual. And is that acceptable in the context of care, when people are, by definition, needing support and are perhaps vulnerable, to expect them to take that level of responsibility when, people generally already have a poor understanding of what happens, I think it's a tricky area.
Great, thank you. And just for time, we'll move on to James, see if you have any questions for Kate as well.
Sure. Well, I was just going to respond to the issue about local authorities being quite apparently lax. And it is. Alexa is a strange example because it kind of lets in AI through the back door. It's not like a kind of predictive analytics, project where the government or the local government sets out a series of requirements and then builds or gets a third party to build, an AI model that's going to do something like, I don't know, in adult social care, it could be, predicting falls. That's one example that we've come across. But actually, there are government frameworks on the application of ethics by, in the public sector. The Committee on Standards in Public Life published an AI and public standards report last year, but they're still, I think, not very well known. And I think at the time we were doing the interviews and at the time they were implementing Alexa, I don't think there were as many guidelines at that time. But anyway, the questions that I have for Kate are, you mentioned the issue of pilotitis, and it always comes up. How do we move beyond pilotitis? Should we move beyond pilotitis? That's one question. And then the other question is, what should the role of central government be vis-a-vis local authorities? Should the central government be providing guidelines or some kind of advice on technologies or investment? Or should they just be providing more funding to local authorities and local authorities then decide what they should, how they should use those funds, or something else?
Yeah, pilotitis is a real challenge, and part of the challenge, I think, is not just that local authorities want to pilot things for themselves, but when they pilot things for themselves, they're not necessarily brilliant at sharing the findings of those pilots, or if they are, it's only when they're successful. Rather than where it's gone wrong and what learning can be learned, can shared and taken forward. And it's certainly in another part of the Sustainable Care Programme, we look at innovation more broadly, and it often focuses on the innovation in and of itself rather than the processes around it and how you got there. And I think with a complex intervention like technology, you need the insight around the processes and the context and how it came to produce the outcomes. To be able to understand then how you transfer that to your context, rather than assuming it's going to work in exactly the same way and be really predictable. And it's this understanding of the importance of context that links then to your question around guidelines. How do you create guidelines that can be flexible enough and attentive to enough to the challenges that differ and the context that differ? The part of the problem that was identified with the whole preventative technology grant and the other grants in the UK 4 Nations, but they were very top down, didn't appreciate local context, and then ultimately reinforced and widened differences in local authorities, because the more advanced local authorities got the most money and then developed their service further, creating a bigger gap. So I think it's about guidelines that are sensitive to context, that talk about examples that can be relatable, talk about processes and how technology is used and by the various different stakeholders, rather than assuming it's one thing used by one group to produce a very predictable set of outcomes. Investment, again, challenging because you will end up with these widening gaps, and maybe there needs to be more targeted investment in looking at the challenges that particular local authorities face and offering up funding that is more targeted then, rather than here's some money for digital. And then, as we know, the trailblazers, as they might be called in the sector, get the second round of funding and the third round of funding, and it just creates greater difference between the various local authorities. And for users, then that is, your neighbouring local authority might have a fantastic technology offer, but you just can't access that yeah, those are my thoughts. I don't know.
Great. Thank you, Kate, and thank you for the questions. Now going to move on to Maria. Any questions for Maria? So, Kate, first, do you have any questions for Maria about her presentation or the remarks she's made?
Yeah, I thought it was a really interesting presentation. I thought I wondered about the individualism being as part of the sort of central ethos. You know, the individualism is really key, and the way that perhaps technology, the way it's viewed as disembodied care, aligns nicely in theory. You know, in discourse. You know, the idea that, but that neglects actually that technology it's disembodied care. You know, it does involve. You know, it's not. You can't just put the tech in and walk away. It brings in relationships, it connects people in different ways, and it sort of has a veneer of individualism, and that what that means then for the very individualistic sort of ethos and the whole idea of individual responsibility, and that ignoring that these things create new dependencies and interdependencies. And I just wondered if you could talk a bit more about all these tensions that I saw between the discourse and the practice and
As you well say, there are tensions in this area, really, about how, I mean, it's really using, I think, the idea of individualism and how, well, you all want to be independent, and the authorities here, they prescribe for the older people as everyone wants to have their independence, not relying on family or anyone else really, but the technology will create your independence. So yeah, that's really, I think, and when older people find perhaps not that they cannot live up to these standards really always, since due to very, very different reasons, of course, I think it's creating a resistance in this area that I don't want the technology at all. It's not for me. It's not what I'm all about here. So that I think you can see it, and if you're looking at how much we really are using, I've taken a couple of numbers here. For instance, like cameras for surveillance or GPS technology. It's only about 50% of the municipalities that actually are using it, despite this overarching discourse, how much, and they are really promoting the cameras for as I call them, surveillance cameras. They are calling them security or safeguarding cameras, that they make you independent, because nobody will come into your home at night and, check you out. And so that's the whole selling idea. But really, the older people are not really buying it in that sense. So there are tensions and resistance, I think, in this area.
And James, do you have any questions for Maria?
I'll just ask a quick question, which is, so you were talking about, and I found your talk really interesting. You were talking about how technology, the technology providers were kind of invisible in the policy documents. They didn't. They were left out from the kind of issues of concern, I guess. I wondered if you could talk a bit more about that. Was it because it was seen as maybe unpleasant to associate care with, profit, or, the people providing supporting technology companies through care applications, or do you think there were other reasons at play? Thanks.
Really good question, I think, in that, no, because they were invisible, really. It was the municipality or the large, we have really 3 large cities in Sweden, so I had to choose one of 3 when doing a category with A1, and that they mentioned just briefly that it was an opportunity to cooperate with corporations and so on. But just very briefly, in terms of interventions or inventions, really. But in all the other documents from all the other municipalities, it was not mentioned at all who will provide these technologies. And so I don't know if it's still a political inheritance from the time where you shouldn't be that the private investors couldn't gain on this, but I mean effectively they do. We have these companies that is providing technology for us, so I cannot really answer why the reasons why. I guess it's not really, no, it's at the same time, no, I think it requires more thought, really, but I assume it's tradition still, some kind of cultural tradition here still, for what company, how you view the state and private sector view each other.
Great, thank you. Just conscious of time, I want to make sure everyone gets a chance to ask a question. And actually, I'm going to use my comment for you, Maria, and thank you again for your presentation. It's really helpful and instructive. Learning about a different kind of welfare system in Sweden as opposed to the UK context to figure out how technology is being understood discursively within social policy over there. So thank you for that. In your comments, you mentioned the use of cameras. So security technologies, safeguard technologies, but also now entering into care. And I think it's interesting thinking about these technologies as boundary objects, drawing upon kind of STS literature and saying, this is my question for you now, James, transitioning to that is, when does a technology become a care technology, right? So if CCTV is traditionally used as a way of securing premises or being able to look at who's there, but now it's being used increasingly in care homes and even people's own homes, that's transforming that relationship between that technology and how it mediates our lives. With Alexa, consumer technology, that's now being increasingly used or curated by local authorities and their provision for older individuals or people with disabilities. When does that technology become a caring technology as opposed to a consumer technology?
That's difficult. Yeah, I mean, it's a difficult question. I think one of the, well, I'm not going to answer the question, but I'm going to talk around it a bit, which is, I think one of the interesting things is how there's an assumption, I think, that technologies can be easily transferred between different domains. So, for instance, with Alexa, there's a sense that it's so universally applicable that you could just easily apply it to different areas, care, providing, helping to support independence at home. I think that loses the specific context of, for instance, care. And there's a danger that if those concerns aren't considered, and I think that's partly the impetus behind things like co-production and participatory development, you don't get at the concerns of the people who actually have to use these technologies, and you don't grasp the way that it reconfigures human relationships, commercial relationships, relationships with local government or whoever. But yeah, I'll have to think a bit more about what makes a technology a care technology. Yeah, it's a good question.
Yeah, I just think it ties to Simon's question about the definitional, problem we have in this context. What makes digital technology, or what makes it internet-based technology, or ICT, right? All these different kind of definitions we all see thrown around as umbrella concepts. But what makes something a care facilitating or care enabling technology? I think that idea of the boundary object we see from Starr in a lot of STS literature is a good way of kind of saying, it can be care and consuming based on the situated practices of individuals in that. So it's more of a provocation, I guess, than an actual response right now for how we might think about this in the future. So now, other questions for James. We're losing conscious of the time. Kate, do you have any questions for James?
Yes, I wanted to talk a bit more about the individualized risk and responsibility. This then leaves issues of equality and social justice and fairness, but also on the back of what Maria was sort of saying, the way that these devices are being sold to older people is not surveillance, it's security. How did the local authorities touch on at all how they were selling this shift in responsibility? Is it selling independence? Is it selling how are they able to hook older adults into basically taking on the risk themselves to have these technologies which are being now reclassified as care technologies, or being repurposed, or their scripts being changed to be focused on technology? How are older people being persuaded, or care users being persuaded to play along with it?
Yeah, I think this is where. Oh, I'm getting a bit of echo. I think this is where the pilot comes in as a really useful rhetorical device, because a pilot, it doesn't suggest any long-term commitment to a new technology. And I do wonder sometimes where the pilot's kind of deployed as a way to perform innovation in local authorities without having to actually commit to any radical or structural change. So I think it's quite easy to sell a device like Alexa or something as a pilot, because there's no sense that it's going to replace, existing care services. And possibly that's a way of selling it to individuals. You try it as a pilot first, you get used to it, and then actually maybe it can be used longer term. I think that the discourse of independence, remaining independent, was definitely used by some of our interviewees. It's this typical kind of nexus of it's going to provide more independence for the user, it's going to save us money, and it's going to provide better outcomes, which I think a lot of these pilots are trying to get at. I mean, we've seen in public documents of, Hampshire County Council, for instance, they've been doing an awful lot of work to try to build their own evidence base to demonstrate exactly those things. And I think how councils present themselves publicly and through local media can really, that try to present technologies as part of project of the local authority becoming smarter and providing better services and being more up to date. But I'm sure that it's different in different local authorities. I mean, there's so many, and they're all doing their own thing.
Great, thank you, James. Thank you, Kate. And Maria, do you have any questions for James?
Yeah, I'll try to make quickly here. I thought it was really, really interesting, and I've underlined it twice here. The new versions of local authorities, you said, which I thought, that was something I need to go more into here. And you say they function as enabler or facilitators, really. But I wonder who is responsible for meeting the care needs? If the authorities, if I don't misunderstand, they take a step back, or is it?
I think that's the impression that I got from several interviewees, that they saw, as we discussed, they saw local authorities' role as shifting in a time of not having enough resources to being a mediator or a facilitator. Since they don't have the funding themselves necessarily to provide these technologies, and they're depending on individuals to get them themselves, then I think they saw, this is kind of an idea of how they would be in the future. I don't think they were saying this is how they are now, but I think this is looking forward to, a conservative government, particularly post-COVID, where there might be less money available longer term, although there's been a huge boost in the short term, but longer term, it seems less likely that they have as many resources. So you see this reliance on technology, or imagining that in the future they'll have to rely on technology even more, what that means is rely on the public sector, the private sector, right? Because technology, you can't rely on technology. So yeah, that's a bit. Who's responsible for care needs? I mean, the statutory responsibility lies with local authorities, but in reality, if you're using private sector services and you're mediating a consumer relationship, I think it becomes a bit blurry where exactly responsibility would lie.
Yeah.
Thanks. Kate, were you going to say something? I think you're muted.
Yeah. Can you hear me? Can I unmute myself? Oh, you can hear me. Yeah, with technology in adult social care, it's not actually a statutory responsibility to provide a technology service. That's why they are so different. There isn't. Local authorities have certain duties around care and well-being and things like that, but there's no mandated role for technology as such. So they can sort of step back from providing technology if they could make the case that they could still achieve the care outcomes and the well-being outcomes without it, or deploy it in a different way. Yeah, there isn't a minimum requirement in terms of you have to provide X type of technology or anything like that. But if you do provide technology, there are certain standards it has to meet. If it's going to be a social alarm system, but those standards don't apply to the deployment of things like Alexa because they're not social alarms, so there aren't the same sort of requirements around what it needs to do. Its introduction into this space does pose questions around standards and there are voluntary standards around Internet of Things devices and things like that, but they're not quite as strict as they are for telecare devices, where there are certain requirements around battery life and things like that. So it does open up questions really around that, as well as it allows for the shifting of responsibility, this sort of technology area and local authority responsibility.
Great, thank you. Conscious of the time, before we wrap up, Simon, would you like to make any final remarks as the discussant?
Well, I've had an interesting experience because in the middle of immediately after I made my presentation, BT decided to upgrade my phone, my broadband connection without telling me. So my entire internet went down for about 20 minutes. I've not been able to hear anything. But I thought maybe there's a metaphor there somewhere, because it's caused the most enormous disruption. I literally have got no idea what you've been talking about. When I came back, sounded really interesting, but I missed the vast majority of it. So enormous disruption. I have got a better service at the end of it. So, technology is good. But the bad news is that it's not saving me any money. They're actually going to charge me more for it. So there's probably a moral there, a metaphor there for technology and adult social care somehow. That's the best I can do, not having been able to hear anything.
That's fantastic. Thanks, Simon, and welcome back then for being able to join us when you could. In that case, without further ado, I will end the session. Thank you, Simon, for joining us as discussant. Thank you, Kate Hamblin, Maria Nilsson, and James Wright for joining us today for the panel and presenting today. And without further ado, I'm Matthew Lariviere, and this is the end of the session. Thank you.